When the call came up for priority needs in La Loche, I thought, I really need to go up there. I had friends in Beauval that was getting hit quite hard, and I wanted to be in the north in some capacity. On May the 2nd, I started in La Loche. They asked me to stay till May 29th, and I've been extended 3 times now. The spread was so active, and so the cases were just accumulating by the day, but there just wasn't enough manpower at the time to fully expand the testing, and so that was what our crew was brought up there to do. And we went and did, in Canada at the time, there was nobody that was doing door-to-door testing, and so there was really no algorithm to follow or nothing, but we were just here's the PPE we need, here's the criteria that people need to get tested for, and then here's where they need us. We were testing 40, 50, 60 people a day. And we were, after we get the positive results, we have to do follow-ups on them every day. And so you have to be able to connect with people and ask them how their symptoms are. And the problem is that a lot of people didn't have phones up here. So it was really difficult to connect with people and actually have a phone call conversation with them. Fear will make you wary, but fear will also trip you up. And if you let fear paralyze you, you're useless. I didn't want to be paralyzed as a healthcare provider because I knew that us as healthcare providers are very valuable in situations like this where we have unique skills that would help to contain the spread. So I went up here knowing I have PPE. I am very conscious about germs in the OR, so that gave me a whole new level of understanding in terms of spread and contamination and what was safe and what wasn't. And so I had in the back of my head always this information that I could contain it, I could safely work with it, I didn't have to be afraid of it, I didn't have to be afraid of people with it, as long as I was using my PPE properly. Donning and doffing properly is the most important thing, because you could have all your PPE on, you could have 10 N95s on, but if you don't take your PPE off properly, you might contaminate yourself. And so all that knowledge, combined with the fact that I had a strong desire to actually help contain this, was always what propelled me forward. For me to see the work that the team that came up here to do the work, to see what they did, and the people before us that actually live and work here every day, to see what they accomplished, it was holy cow, I can't believe that this went from 348 cases down to 0 in the span of a few months, which is a tremendous task when you think about it, but also huge credit to the community, because they did what they were asked. They distanced, they wore masks, they washed their hands. They didn't get to come together to celebrate weddings. People still got married. They didn't get to come together to celebrate the people's lives in funerals and wakes. They kept their group sizes small. They isolated themselves at a tremendous cost to their probably their mental health, their psychological health, their spiritual health, but they did what they had to do because they wanted to see the end of it as well.